The Steps Hip Spica Care DVD is made for parents and carers of children in hip spica cast. They are a series of mini videos which cover aspects of looking after a child in a cast. The videos are examples of how real families coped with everyday tasks of looking after a child in a hip spica. They are not meant to be fully comprehensive and cannot tell you everything you will need to know about hip spica care, but hopefully they will reassure you that solutions can be found to many practical problems. Remember that it is best to contact your healthcare professional if you have a problem you cannot solve. Parents, carers and healthcare professionals have reviewed these videos.
So on the Saturday, so it was a couple of days after her operation, we'd been using a wheelchair on the ward to push her around, and it was just big and cumbersome, and we were desperate to see if she was going to fit in a normal buggy. So we brought up her buggy and also her car seat up to the ward just to see whether or not she fitted in. And just with a simple pillow stuck behind her, she fitted quite easily into her buggy. And with the car seat, just with a rolled up towel at the back, and we showed the nursing staff so that they knew that we could get home nice and safely, and they were really pleased to see that. And then afterwards, the sort of afternoon came and went. She came in to see us, and suddenly at 20 to 5, I'd happened to go down to Mass in the chapel, and they suddenly turned around and said, "Oh, by the way, if you want to, you can go home." But we didn't have a bedpan. And they were meant to have posted us a bedpan through the post, but it hadn't arrived. And unfortunately, they have a policy whereby they only have a certain number on the ward, and they wouldn't let us borrow one from the ward just to get her home because they've had problems with people not returning them. So, that was the policy on the ward. But we were really quite upset by the fact that she wasn't going to be able to go home and have to stay 2 nights. So Matt went off on a wild goose chase to try and find a bedpan, so that we could get home. And in the end, thankfully, because of his contacts, he was able to steal some from the ward on which he worked, which were disposable. So we got home, but we'd known that we could potentially take Bethan home, but we hadn't said anything because we didn't want to get her to get overexcited. And then all of a sudden, when we realised we were going to get a bedpan, we suddenly announced to Bethan, "Oh, we're going to go home." And it really threw her because she wasn't ready to go home. Nobody had told her she was going home. So it was quite upsetting that she then sort of had to say goodbye to the little boy and the little girl that she'd been in the same room with. And it was quite suddenly a big upheaval for her. And all of a sudden we put her in a buggy and we took her off the ward within the space of about half an hour. And she wasn't upset, but it definitely, it caused her a bit of anxiety. And we suddenly then had to put her into a car seat, and it was the first time we put her in a car seat, and you could tell she was a bit unsure of how we were lifting her, and we hadn't quite got our confidence yet. So it was quite a difficult night, that first night, and we brought her home, and we hadn't done any adapting around the house because I wasn't expecting her to come home that night. So it was a bit of a make-do really, and thankfully my parents came and stayed, so we had an extra pair of hands to look after the baby whilst we were taking care of Bethan. But it was quite hard work that first night. And then the next morning we went out and we bought lots of pillows to put her on, and we bought a block of foam and started making a body roll and got ourselves together about how we were going to look after her, and worked out that she was able to fit in one of the chairs. But that first night was quite difficult.
Remember, you are not alone. When you want information, advice and support, our helpline team are here to help you. No matter how big or small your concern, please email or telephone our helpline. Get instant access to information 24 hours a day via our website, where you can download our advice leaflets. You can also visit our online chat forum, which provides a fantastic resource of helpful tips and practical advice written by parents who are coping with a child affected by hip dysplasia.